our little conversation. Okay. So do you want to all just introduce yourselves for those of us who don't know you? Again, I'm Jill Kagan with Arch.
I'm Sue Larson with the Wisconsin Department of Health Services, and I am within our Division of Medicaid Services. And we, in my bureau, we focus on programs that serve children with disabilities and delays.
Nice to meet you, Susan. I'm Molly George. I'm a doctoral student in gerontology at the University of Nebraska, Omaha, and I'm also getting a dementia respite program off the ground here in Lincoln, Nebraska. So good to be here.
Great. Wonderful. Thanks for coming today.
So I'm Rebecca Hyde. I just started a job with New York State Caregiving and Respite Coalition, and I'm the coordinator of their voucher program.
And that's a relatively new voucher program.
Yeah, I started in January. Yeah.
Lynn, you want to go next?
Yes, ma'am. I'm Lynn Fines. I'm with the Idaho Commission on Aging with caregiver supports, respite, and dementia capabilities.
And I think Yasmin, you're the last one in the group, unless I'm missing somebody.
Yes. Hi, everyone. My name is Yasmin Orozco, and I'm with Aging and Disability Services Division. I work with the Nevada Lifespan Respite Program, and I am the program coordinator.
Great. Thank you all for being here. The first question I have on my list has to do with family caregiver education and engagement. And I know depending on how long you've been running your voucher program, and Nevada probably has the most experience right now on this particular group. It's important we've learned that it's important to let family caregivers have, well, not all of them do, but a lot of them do need some personal assistance in finding providers or even understanding what the voucher program is. And I know from one of our very first voucher collaborative meetings, this was a hot topic because some voucher program administrators were spending a lot of time with individual families trying to help them just navigate the voucher system. Especially families who don't have their own natural community of support. They really had no idea where to even look for a respite provider. So this was a topic we wanted to share more between programs about how much staff time is used, what kinds of assistance do you provide to family caregivers, and what's it costing you in terms of staff time and administrative time if you're able to do that. Is that something you might be able to talk about, Yasmin, with a little more experience? And I know you've had at least one voucher pilot in Idaho, right, Lynn? Is that correct?
Yes, ma'am.
Do any of you have anything to illuminate us on around that issue?
Well, I'll start. I will start.
Okay.
We're still, learning our lessons, and which is good. We're in a really good place now because we can learn from everybody across the nation on how they've implemented and best practices and things. But I think Idaho is very comfortable with the one-on-one. They're very comfortable with the home visits. They like to go out, meet the caregiver, walk them through the process, really hold their hand to start. You asked some really good questions about the time it takes, depending on how far they have to drive to get there. So it can range anywhere from an hour, to 4 hours. It all depends on the circumstance. And
Well,
if
can
they
you back up a little bit? When you say home visit, you're actually conducting a home visit in order to issue a respite voucher?
In some cases,
Wow.
yes. Not all.
Uh-huh.
But I know some of my social workers are very comfortable doing it, going to the home. And it's funny you asked me that question because I'd have to have her with us to find out, what delineates, what makes you want to go to the home compared to somebody who just calls in and is eligible. So, right now, due to funding, it's a very we don't have that much funding. So there's, we don't have, it's more contained, let's put it that way. It's easier to
Right.
do these home visits rather than a big expansive program across the state,
Is this a voucher program with your lifespan dollars or a different program?
This is with the lifespan and Title E3 funding. So both, those that are qualified for lifespan, we use the lifespan grant, and a lot of that is kinship,
Right.
a lot of kinship care.
Well, I'm fascinated by the home visit. That's very intensive and wonderful.
It really is. It really is.
Caregiver.
But you asked a good question about the ratio. I'd like to know, that's a real question I want to ask my AAA is, what's the ratio between a home visit and a
Right.
call-in?
And how do you make that decision of who needs what level of assistance? That's another very good question. First we have to decide, do they need any assistance at all? Or do you just hand them the funds and say, go get respite? And then deciding, how do you decide how much level of assistance they need? And do you have the staff time and resources to provide that? Does anybody else do home visits or considering doing home visits for assessments?
We do not.
That's interesting.
I'm not opposed to it. I would certainly be happy to do a home visit, but I'm working remotely. My organization is in Rochester and I'm 2.5 hours away working from home. So I'm still open to driving across the state, but I'm brand new, so I'm still excited about it.
You're right. It's very case specific, I think, and very regionalized, not everybody, not in every region, but for Idaho, I think that's really the way to go. I mean, for us, we like that, one-on-one, that trust has to be developed and stuff, but not all cases are home visits, but a majority of them are.
Right. It's very interesting. Have you, again, for those of you who provide that level of assistance to family caregivers to help make sure they get the respite once you've given them the voucher or awarded them the voucher, have you seen a need to train your workers specifically around how to provide that guidance? And if so, what kind of training are they getting?
Yeah, unfortunately, I can't answer that question because I only started last week.
Yeah, I mean, I think in New York, some of their planning around the respite voucher, I know you're all planning to use the life course tools for respite, which we developed in conjunction with the University of Missouri. And those tools are wonderful for helping family caregivers decide, look at their schedules and help them decide that in fact they need respite and when they could get respite. But also to institute some planning time. What will I do with my respite time once I have it? And it's really kind of amazing that a lot of family caregivers, maybe they've thought, well, I need, an hour to go to the doctor, but have they really thought about what they would like to do with their respite time that would be most restorative and helpful to their well-being? And so incorporating some tools to help them think about the respite planning time. I know in Nevada, I believe you use the life course tools as well in your voucher pilot program. Did you know?
Yes.
Yeah.
Yes. And I'm currently, helping out with the emergency respite funds, which is the self-directed voucher. It's been a great success. But what I have most of the issues with is I do spend about 30 minutes from receiving the application, or sometimes I have to help out the family caregiver, fill out the application with them over the phone. Technology sometimes makes it very difficult for them to fill out the application to seek respite support services. And then once I let them know, well, this is a self-directed voucher, they can't think of anybody in the area that is able to come in and provide that respite. So I try to dig deep with them and we can provide some outreach to the community, or sometimes I help them with, you know, can we contact your church? Can we contact your community center? Anybody, especially in the frontier areas, is where I have the most difficulty with outreach. And so, yeah, but it's still, you know, surprisingly, it's been very successful with letting families know of respite support, and they're like, oh my gosh, what is this? I need it. I need to go to medical appointments. And sometimes I have that intergenerational caregiver who's presently pregnant, and they're taking care of their elderly mom, and they're also having grandkids in the household. So yeah, it's quite the process, very extensive.
I would think for an emergency respite voucher program too, it's especially difficult for a lot of caregivers to find someone. I mean, there's so many respite programs that will not even take someone on short notice because of requirements around, you know, needing medical records or needing immunizations or whatever it is. They can't even accommodate an emergency respite situation. So I'm sure that that kind of program requires even more intensive assistance. What do you actually make the phone calls on their behalf, you know, to their faith communities or to other programs? Do you go that far, or do you just give them the phone numbers of people to call?
Yeah, I just provide them the phone number so that they can feel comfortable in calling, just because I'm not in the household. So I'm not able to provide that assessment of what exactly they would be helping out with. I always, you know, try to get them to see it from the side of companionship, and, you know, none of that PCA services that they may be in need of in the long-term time frame, but in the immediate emergent need, you know, I try to think about it as like, okay, you know, if they could come in and sit for 3 to 4 hours or 6 to 8 hours, depending on what your time frame is needed for, you know, how can we help you make the person feel comfortable in coming into the home without feeling this pressure of responsibility in providing, you know, that personal care versus just respite care for
Right.
the care recipient and respite.
So in the majority of family caregivers that you're helping identify caregivers, are you successful most of the time? Do they wind up finding someone that can provide the care?
Most of the time, yes. The hardest population that I have, it has been the intertribal communities and reservations. And it's mostly because the elder care recipient is very guarded or reserved and who is in the household. So that's been hard, and sometimes they only have one child, or if they do have children, they have you know, jobs and families to care for, and they may not be able to accommodate longer respite times that the person may need. That's been the hardest part. So I'm really focusing with our outreach and marketing efforts with our other project to share that with all of the intertribal communities and their clinics so that they can participate and just kind of feel more approached to the idea of thinking, okay, I can do respite. Respite doesn't mean I have to have all these fancy accreditations and certifications. I could come in and sit with my loved one, or I can sing a song or play music or whatever it may be that makes them feel more comfortable. Yeah, it's just hard.
Yeah.
Getting the care recipient to feel comfortable is really the tough challenge I have.
You mentioned earlier that you spend about 30 minutes with each family caregiver to help them access respite once you've awarded the voucher. Do you do this all yourself? Are you the sole administrator of the voucher? Yeah, so
Yes.
that's a lot of your time.
Yes. Luckily, I'm able to, sometimes I can, with my team, they have plenty of experience and they've built their own network, and I can always refer to Nevada Care Connection for navigation of services in the area. But yeah, it takes me a lot of research. It really is, I think that could be a challenge for, respite voucher programs, is the administrative time that goes into really assessing, okay, how can we help this caregiver? Because what I'm noticing is when they come to me, they're almost in a crisis point, or it's a very sudden event that has happened. And they're coming to me with layers and layers of needs. So I have to start with one and then connect them with the next source of resources for long-term support.
Right. So would it be your advice to a program that was really just getting started in their voucher implementation to make sure they're budgeting for staff time? Again, especially with everything being so virtual now, we think we can just issue the voucher to the family caregiver and, then they're on their own to find the provider in a lot of instances. But in fact, we have to build in from the beginning the budgetary costs of providing more assistance. That was the motivation for this whole area of discussion early on with some of the voucher programs, that they felt like they hadn't planned for that at all, really. And when we did our first survey and we asked, how much time do you spend per client? We had anywhere from 15 minutes to 4 hours. And again, I could see it being more than 4 hours if you're doing a home visit like in Idaho. And they really hadn't budgeted for that amount of time with staff. So it's just an area that should be explored a little bit more. Rebecca?
Yeah, I have a question. I noticed that we have given out a lot of vouchers or award letters. We've sent out letters to folks saying you have this chunk of money that we will reimburse you or whatever. And so there's a lot of award letters, but not a lot of people following up on it. And I'm wondering if that is something that you factor in, that you call people up and you say, hey, we haven't heard from you. Do you still plan on, oh, we have to leave, I guess.
Yeah, we're gonna go. You can come back to this group if you want, or pick a new group, but I'm
Okay.
sure there are people here who'll be able to answer your questions about that.
Okay.